is a joint action funded by the European Commission to define and develop the guidelines and implementation acts for the implementation of the European Health Data Space Regulation. The development of systems that they talk to each other to exchange data while the citizen is traveling within Europe.
The regulation is defining what needs to be done, and then Xt-EHR really specifies the technical specifications for how this will be done.
So we had to extract from those legal articles what would be the meaningful technical requirements.
We have identified the general requirements of EHR systems. We also specify the format, this xt-EHR XF.
Which is the standards that will make this data flowing really across border.
We specify the clinical content, what we call the logical models.
Meaning the definitions, what information need to be shared.
We felt that IHE Europe and HL7 in Europe really need to come together, because it's a big challenge to really come to implementable specification.
The Xt-EHR logical model is based on HL7 FHIR resources that are used along those 6 healthcare priority domains, as we call them. Lab reports, medical imaging, discharge reports, patient summaries, e-prescription indispensation.
And IHE having the IHE methodology to create implementable specifications, use case based.
And regarding the transactional part, meaning the transmission of that content between the different actors, we have a work group which is an API work group.
Xt-EHR was the bridge between policy and implementation. The main achievement is to give a clear picture of how this will be done and how this will be feasible in Europe. And I think it is clear, without surprise to the vendors, without surprise to the market.
It is bringing together member states experts, but also experts from different communities, manufacturers, vendors, to identify the central piece of the future, the system of tomorrow.
The Xt-EHR was a project did assemble the opinions of the various member states.
The overall approach and overall specification has been agreed with the industry.
All of those guidelines, the technical specifications that come out of the work packages are going to inform the decisions on the implementing acts in the future.
Xt-EHR gave a building block that all the European member states can start from. We have a starting point, it's a great basis, it's at the grounds.
So we are talking about an ecosystem that is being set up, and this is key for EHDS implementation.